So, good evening, everyone, once again. Welcome to session 6 of the Master Trainer program. And today we are going to discuss a very important topic, which I'm sure almost all of us handle day in, day out. So, the topic is handling uncooperative patients. So, I'm sure during your practice, during your work, you come across situations when you want your patient to understand your point of view, but somehow the patient and the family are not able to see your point of view, and then they don't cooperate, or they at times even become aggressive. Of course, we'll be taking that topic separately, where we discuss about how do you go about handling aggressive patient party. But to start with, I think we'll discuss initially when the patient is not able to see your point of view or is not cooperative. How do we really handle that situation? So it could be the doctor who is treating the patient, or it could be the nurse who is handling the patient in the area where the patient or the patient's family are not very understanding of the requirements. So if I may ask all of you, what kind of situations do you face where the patient party or patient are not very cooperative? Can you bring some examples for all of us? Yes, Abhishek, please go ahead.
I guess many a times it happens when uh, there are some complications which develop during the treatment.
Mhm.
Secondly, when it becomes a prolonged stay, especially in the ICU,
Mhm.
and if it's a prolonged stay in the ICU, then the bills escalate. So that's the area of contention that's always there.
Mhm. Mhm.
And mostly it happens when I think if the doctors have not probably given a scenario beforehand that so and so
Mhm.
complications could occur.
Mhm.
So they
Definitely.
are, yes, so
Yeah,
I've seen
absolutely.
these things.
Yeah, absolutely. I think that's one area where the condition is critical, and the family is not in complete know of it. And then you want to keep the patient still in the ICU. There is not much of improvement, and you are not even very sure of the prognosis. So naturally, they would have a lot of doubts, questions, concerns, and that means we really need to see their point of view and should actually proactively communicate and establish communication and explain them all those things. At times we do, but they don't understand. At times they understand, but there's a lot of denial and expectations that come in the way. So I'm sure the situation is very complex, and that can go up to any extent. I completely agree. Any other situation that somebody would like to? Yes, Dr. Purnima, go ahead. Yeah, and after that, Dr. Ravinder. Yes.
Madam, it starts from the time that when in OPD,
Mhm.
if there is waiting time,
Mhm.
so that sometimes requires a more detailed communication.
Mhm.
If we are prioritizing patients according to the severity of illness, then the ones who are waiting will require a detailed communication. Then, when we
Mhm.
see the patient, if we require admission, especially nowadays, I have practiced as a pediatrician, so I would say that if
Mhm.
you are advising admission, there may be others who there may be other children in the house, so the parents face constraints of work or leave or something, so it that is a difficult situation requiring communication. It's a challenge. Then when the patient is in hospital, length of stay, billing issues,
Mhm.
issues, because we may have counter referrals or we may refer outside to a different center. That is
Mhm.
a challenging situation for communication.
Mhm.
And last but not the least, discharge. And third, other situations, contingent situations, like if there's a patient deterioration, or
Oh,
God forbid, if there is a death, or if there is a medical legal situation. These are all the myriad situations. And with the recent dictum that we have to counsel a patient for shifting to ICU and
yes.
take a detailed consent, then only we can keep a patient in ICU. I think that is one of the biggest challenges which has come up recently. So all
So I
starting from
think we really have to step up our communication with the patient and family. And I think whatever situations you have narrated, I'm sure you have narrated almost 4 or 5 situations where there is a need to communicate. there's a clear indication that proactive communication from our side is required. We really need to be thorough with the way we are going to start our conversation, and then also address their concerns, and also if they are not able to understand, how do we handle that. I think the problem is, if you are able to explain to them and if they agree, then I think it's not that difficult. Situation goes out of hand when they don't understand, and even we don't know how to make them understand. That's where we are actually in that loggerhead kind of a situation, where we are right in our at our on our side, and they are right on their side, but we don't understand each other's point of view. And then there's a lot of misunderstanding and miscommunication and false allegations and true allegations, and that's where the things go out of hand. So I think that's the beginning of state where people don't understand our point of view. But I think you have narrated lot of number of situations that we come across. Raminda, you wanted to bring about some situation, if you would like to share.
Especially when it is a small child involved, met with an accident or some
Yes.
emergency and not being attended, or if it is a disaster situation when you have a lot of casualties and maybe there are not enough people to explain and you ask them to wait
Yeah.
outside
Yeah.
just to avoid the chaos, that may create a lot of problem among the family
So,
members. And
so Ravinder, I think what you are bringing in, like for example, especially if there's mass casualty,
yeah,
so definitely we need to have a communication, arrangement for such kind of situations. So we have disaster communication, so that should be in place. Although that's very important, but we are not going to talk about in this session. The focus is going to be, for example, one-on-one when we are interacting with the patient or their family member, and then we need to, communicate to them and address their concern. What should be my communication style? How should I handle that? I think we are going to focus on that specific area of. But of course, you are very right. In such situation, we definitely need to have a system where we, have, like for example, we have recently seen COVID. So we have seen how we have to communicate in disaster situation or crisis situation. I completely agree. Any other situation if somebody wants to bring in any example that you wish to say? Yes, Dr. Abhishek, you want to say something more?
Yes, so I also feel there is a lot of sometimes miscommunication and gaps in communication when we have a situation again in the ICU where we have to explain about do not resuscitate or do not escalate the treatment.
Mhm.
That
Oh,
is
yes.
a very, very delicate situation. Many relatives, many don't understand, needs a lot of talking and counseling. And I think
Oh,
if
yes.
not done properly, it leads to a big mess.
Absolutely. I think you have taken a very, very, a very critical topic that you have talked about, when you have to talk to the family about do not resuscitate or do not escalate the care. That's again, unless you are thorough with that kind of, handling and, building rapport and then connecting with them and empathizing and also making them feel like a team. I think only then probably you can make this communication happen. I completely agree. Yes, Dr. Som, I think you wish to say something.
Being an anesthetist, I see three of patients the previous day, and then one relative will be with the patient. And then we explain the choice, mode of anesthesia, the risks, and then everything with the patient and relatives. And a couple of hours later, we get a call from ward saying that another of the patient's relative would like to have a discussion with them. And then when we go, the patient will give an exactly a different picture of what we have told and what we have got counsel from. The patient has been confused, or the change of minds will happen when someone else shares their story, like I had a backache after spinal, or I
Yeah.
had a difficulty, lots of pain in the after this procedure. I couldn't walk
Mm,
after an epidural, and so
mm,
on.
mm.
Now the question comes, like we have to talk to different people of the family members,
Yeah.
and at the same time convince the patient, and then it becomes a tricky situation at certain times, especially when it comes to major procedures, like when we counsel them, give the preoperative assessment, and we discuss the risks and the benefits of certain procedures and the need for post-operative ICU care. And especially when they land up in ventilator support electively, then so far they would have been accepting to undergo the procedure. Yes, I am willing to do the procedure. And the moment when we say that you are, there is a likelihood that there's a risk of elective ventilation post-op period, then there comes a very difficult task in talking to them or making them realize why it's important. More than the patient, it's the relatives who are surrounding them that will add on to their conclusions. But at the same time, I felt like what I usually do is to sit with the closest relative, or I will ask the patient, do you want to start with one-on-one, or would you like to have a relative, in presence of a relative, you would like to discuss about your health issues? And if so, I would like to ask the patient with whom you want to have a discussion. And then when we have a one-on-one discussion, explaining the risk and putting everything in documenting, many times that helps, especially when an unknown crisis occurs in post-op period. And then when we discuss that there is a chance of blood loss, and it happens that there's some surgical mishap has happened, like some vein or artery has been damaged, and then we end up in massive transfusion or elective ventilation. Then it becomes easier to discuss with them that we have discussed about blood loss, but we didn't anticipate so much of loss or this one, and then we are sending you for elective ventilation and so on. So that becomes an easy point to discuss if we had discussed the complications of the job.
So, Dr. Som, I think you have answered your own question in number of ways. The way you have explained that how you handle it, I think that's what we are looking for. I think, first of all, identifying the primary caretaker who's going to be with the patient and 24/7. They're usually the first family members, and if we are able to identify and always establish communication and rapport with them, I think it becomes easy to communicate further, because you have created that familiarity and comfort and that trust that the patient would have in you, that yes, you are communicating with them with great responsibility and you are answering their questions. So automatically they'll have this faith that you are a responsible doctor. Then also, when you take consent for any procedure, and especially if there is some amount of risk involved, or even if no risk involved, but then we know there is no risk-free surgery or a procedure, and you talk about those risks, I think they evaluate both the things. One is, of course, the risk, but at the same time, they also see that you are coming out with all those risks. That means you are being very honest and transparent in your approach. So that further helps you to establish that reputation that you are a responsible doctor. I think that's very important communication that you have talked about. And then whenever something happens, how you behave, how you handle, how you act plays a very big role. If you are still in touch with them, you are answering their questions, you are updating them, they would have this feeling that you haven't done anything deliberately, you haven't done anything carelessly. I think that's what they want. So I mean, you have answered your own question, that if you are able to do this, I don't think there would be much of a conflict that you will have to handle. Mostly, I'm sure you will be able to satisfy them by explaining that this was one of the possibilities, and we have taken all care, and we will take all care, and we will look after the patient, and we'll see how we can minimize the damage. So this thing we will be discussing at length when we will be talking about two topics, that is breaking bad news and disclosure of medical error. So when I say medical error, it could be error, it could be complication also, because for them, complication is also an error, if we look at it from the patient's point of view. But like very rightly said by you, that whenever we tell them that there is, we had explained to you. So let me remind all of you, there is a cognitive process called selective listening, selective forgetting, selective attention. We all have this challenge, not just the patient or the family. We when we buy a product, the salesman tells us that this is possible. That time we are just so excited to buy the product that we don't remember that the salesman had talked about this. Same way, when you explain to your patient and they are in pain, or they are just wanting to get the relief, and they are coming with the expectation that after my knee replacement surgery I will be able to run, because that is what is shown on TV and on the media. So they just forget that you explained that it will take you at least 3 to 4 weeks to actually walk comfortably. So I think that's also one area we have to remember, and we have to allow that that cognitive process to go on, but we have to reiterate. So I think this particular session will help us, learn how to go about whatever we have talked and whatever we have discussed, and they say you have not talked or you have not discussed with me. How do we reiterate? How do we communicate with them? So to start with, I think, so for all those who joined after we started the discussion, because Dr. Razak and Dr. Bijay joined after the discussion, or Anu also joined later. So we are discussing today about handling uncooperative patient or uncooperative patient party. So we are trying to take different situations where, I mean, there has to be some amount of, I don't want to use the word tug of war, but there has to be some amount of discussion where you really need to hold the fort, stay calm and communicate with them and answer their questions with courage and confidence and truthfully. So that's what we are going to learn in this particular session. So to start with, we will do a role play. So I'm going to give a situation where there's a patient in your ICU and the condition is not good, and I'll be sharing the case with you on your screen. So I want somebody to be the doctor on duty who is going to talk to the family. The family wants to take the patient Lama because they are just not happy with the way the patient is being looked after. They are not even happy with the way the staff is treating them, and also the security guards are not very nice and polite and kind to them. So all that, I mean, usually that you get to see in a lot of setup. So we are going to take that situation, but I want somebody to first volunteer to be the doctor. Dr. Vijay, you will be? You will?
Yes,
Okay. Thank you. And I want any two of you to be the patient's attendant, because patient is in ICU, so we don't require patient. So I just want two of you who can actually, do that concern that you have. Okay, Raminder has raised her hand. Great. One more person. Okay, Anandita. Great. So Anandita, you and Raminder, you be the daughter of the patient. Both of you are daughters of the patient. And Dr. Bijay, you are in the ICU and you are the doctor who is looking after the patient. So let me first share the screen with you, and then I give you a set of further instruction. Give me a second to. Okay, this is the case study I want you to. Okay. Is it visible or you want me to increase the size?
No, ma'am, it's visible.
Okay.
It's visible.
So let me know when all of you have read it. I'll just take it further. No, I know this is the case study. Yes, this is the case study. So, Dr. Bijoy, Anandita, and Raminder, have you complete read it? Have you done with reading? Are you done with reading?
Yes, ma'am.
Okay, so can I stop sharing, Dr. Bijoy?
Yes, ma'am.
Because he's still looking at the case study, so I thought you are still trying to get the.
Yes, ma'am. Yes, I was.
Okay, fine. So we assume that you are in ICU, and Anandita and Raminder, both of them have come to ICU, and Anandita and Raminder, your agenda is that you have come to tell that we want to go Lama, and we want you to give us the documents, and we want to take the patient. So meanwhile, all of us will switch off our videos and we'll observe how the whole interaction goes, uh, and try noting down whatever you observe in the way Dr. Bijoy handles it. Of course, the family can behave the way they like. We are not going to, focus on that. Our focus will be on how Dr. Bijoy handles that. And I mean, will 2 to 3 minutes of time be okay?
Yeah.
Yes.
Okay. So we are going to switch off our video, and once I come in, that means we are going to stop here. Okay.
Dr. Vijay, my mother is admitted in the hospital and her condition is deteriorating. She came walking, and now there are so many things, her things are getting worse. We are not satisfied with the way the things are going on.
Yes, you see, your mother's condition is actually not so good. So I think she needs some continuous treatment and follow. You know, she's in the ICU right now. She came walking, but that time itself, she was a bit disoriented and confused. And on further follow-up, we got a stomach bleed was there in her, and right now she's in a state of multi-organ failure. So I strongly suggest that it won't be wise if you are taking her out of the hospital. Do you have any particular issue over the treatment?
Dr.
Or
Vijay,
yes,
being a doctor, I would also like to share with you, like she had multi-organ failure, whatever renal output was low or whatever, slowly and steadily we have given to the hospital for good only, right? So if the
yes.
patient is deteriorating, what were you doing? So
Uh,
I think my sister would also agree with me. We are not okay with it. We have to shift it to somewhere else where my mother is my priority. I cannot allow you to keep experimenting with my mother, right? So
I'm
Yes,
so
I
I'm very
sorry.
also
I'm
say
upset.
so,
that
I'm
you
very
cannot
upset.
be doing that to our mother. It is so
Yeah,
difficult.
very, very
We have
upset.
not brought her to get her condition deteriorated. It is in
Yes,
the hospital that her condition got deteriorated.
we had come with
no,
some
I'm so sorry to
expectations. You
hear that.
cannot, no, doctor, no, this is not done. You have to
Uh,
understand this.
No, I'm so sorry to hear this because I think
No,
we are doing
see,
all
yes,
possible.
sorry,
We are
thank you
doing
won't
all
help me.
possible medical measures which we can do from this hospital, and I think all possible things which is needed for your mother, the patient, we are providing it. But in spite of that, her condition is not improving, and we are still working on her.
So,
And you know,
doctor, do you
she's
mean to say you are not able to treat her properly? She is in
no this kind
ICU.
of. I agree
We
with
are
you, but
literally worried about her. And
no, I
she
totally
has
understand
become,
your concerns. I
no,
totally understand your concerns, but actually, her condition is a bit critical. But even though she came
that's what
walking, but
the
that
question
time
is.
it's
How come she has become critical? She was all right, right? And then slowly, steadily, she is deteriorating day by day, and she is having that multi-organ failure also, doctor. You still suggest that I'll be still keeping my mom here? Should you, don't
Many
you
times
think
when we are
you
making
are
call also,
rectifying?
nobody is responding and they say,
Yes.
wait, the doctors are on run, wait, and we have to keep waiting outside.
Also, in front of the lift, we have to keep waiting because the security people, they stop us. That not, this is not the visiting hours or whatever. Here, my mother is in so much of danger. Would
no,
you
I
have kept
agree.
your, no, no,
I
doctor,
totally agree
you
your
think I'll still,
concerns.
doctor, you
Uh,
think we should keep our mother still for the experimentation purpose? Should
yeah,
we
we are
not
not.
put?
I'm so sorry to hear that, but I can assure you that we are not doing any kind of experimentation with your mother. We are giving all possible medical measures possible, and I'm so sorry to hear you have to face a lot of hardships from the security part and all. But our hospital is having certain visiting time, and especially your mother is in the ICU, so we cannot allow everyone to come. We have a particular visiting hours, so that part is because of that. But regarding the treatment part, I think and I can assure you, no kind of negligence or nothing is happening as for now. And her condition, because we can try all the possible medical measures in our hand, but the recovery process is not completely depend upon it. Depends upon the patient as well. So your mother is not properly responding to the medications which she is
Doctor,
giving.
but we need to be updated. See, maybe that you have restricted, visiting hours, but there should be some provision that we are able to make call and find out the situation of our mother. We have to
Yeah,
wait
that
for
also
eight
we hardly
hours
get
for,
any response.
we have to
Yeah,
wait for 8 hours to be updated on a mother's condition.
I think daily one briefing will be there after the morning rounds in the hospital. I think the bystander will be called and will be briefed on a daily basis upon the condition of the
No,
patient.
I
That's
am
not
sorry
happening.
to interrupt, Dr. Vijay. You said
Yes.
no, that I'm sure you are sure that you are assuring us that our mother will be all right. What guarantee you can give? Do you have any guarantee that you can give to me? Yes, my
No,
mother
I
is
can
going to
I
get
can
well.
give you a guarantee that we will try all possible measures within our limit to save
But
to
that again is
uh,
the experimentation you're talking about, right?
And you're telling that you are debriefing, once in a day. Do you think in 24 hours we need to be informed only once in a day by the doctor? That's not sufficient. We are worried sitting outside. It is so difficult for us to think about what is happening.
Can I request
Madam,
everyone to
I
come?
got lost after seeing your face. Actually, I was going to say something.
Dr. Som wanted to complicate it further by being
I,
another.
I was thinking how I wish I get relatives of patients like Anandita and
I
Ravindra.
decided,
They
I
are
said,
so.
no. Bijoy would be really. That's why
I
I
hope that was a
decided.
decent show.
Now you see, I mean, I could see Dr. Bijoy on defense, but you were trying your best to strike conversation with them. Agreed. So what do you think, Dr. Bijoy, you did well? What do you think you did well?
No, I think I think I did okay, but the issue I face is that this kind, as a doctor, when I am responding to these questions which I feel kind of what do you say for that as far as patients relatives are concerned, that's so genuine for them, but some medical things and all, to explain it to them in a way which they understand is always going to be a problem. So I cannot talk about these complications and all, and they won't be understanding it. So I was finding it kind of difficult to explain them that part. The remaining part is okay for me.
So what if we knew how to even explain that part in simple language? Do you think that will help family understand the patient's condition?
Yes.
I think yes.
I think that means we need to, earlier they never asked. Patients, family members, they never asked about the medical condition, what is happening, why is the recovery not happening. But today, if you want them to understand that this is what we have done and why this is not happening, then you have to have come down to that language where they understand that language and we can explain to them. But what all did you try to strike conversation or calm them down or to handle them, for example? What all did you think you tried from your side?
No, actually, I didn't try to instigate them. I didn't try to question their claims, like which even I felt is unreasonable. I was just trying to play along with them regarding the timings and all. And regarding the repeated claims that she came walking and she now became sick, that is because of your hospital's mismanagement. Those kind of things, I was just trying to deal it in another way.
Okay, thank you. So if I ask the family members, what do you think Dr. Bijoy did? He tried to kind of calm you down or to address your concern or whatever, like he did with both of you.
He was very patient listener.
Yes.
He didn't lose his patience, and he tried his level best, even though I was interrupting in between. He tried his level best to, make us calm down.
So did that help you to calm down?
Uh, to some extent, that,
No, they didn't come down.
They did. So
No.
had he acted very aggressively, then what do you think how the family would have reacted? They would have further gone, become more aggressive. At least that did not happen. It did not. The problem did not escalate. At least he could hold it. If he could not settle it, but he could hold it. Even that's a good step that he took. Now I want to know from the audience who were seeing the whole role play. What do you think Dr. Bijoy did effectively, or what did he try? Do you think that you endorsed it? Yes, that was right.
It was very cool
Cool.
and calm and collected and tried to bring in sense about the patient's reality of health. Why the patient is in ICU, how she's very sick, and then how transporting her from this hospital to outside will be a jeopardy for the life of the patient.
But was
So,
it? I don't think this was mentioned.
no, he told us. He told that the shifting will be a problem. It's not advisable at this point of time
But
to
then,
shift this.
yeah, but
That
yeah,
could have been elaborated much more
yes,
better.
yeah, agree.
And he was really patient, listening and trying to address their concerns. What I would have done maybe is to give.
Hold on.
Okay. Yeah.
Hold on. I want
No.
others to first come up with what do you think Dr. Bijoy did effectively? Dr. Razak, would you like to?
He was very patient. He was listening.
Of course, he was patient, he
And
was
he very
calm, he was listening. Yeah,
he was trying to understand them, and he was getting into their shoes, I felt. I don't know.
I agree. Yeah. Dr. Razak, do you want to add to it?
Yes, Dr. Vijay was very much empathetic, active listener, very much calm and quiet, and don't actually lose his temper.
Hmm.
But I think there was a scenario to take the patient to Lama. That was, I think it will be better if Vijay uh, uh, reveal them. Yes, you have every right to transfer your patient whenever you asked. I will give every opportunity to transfer the patient, whatever you want. But whenever the patient remains in my hospital, we will try our best to.
Hold on. We'll come to that. So, and anybody else who would like to add to what the discussion is on? So definitely, I think
I
Dr.
like to
Desai was, yeah, yeah, yeah.
I like to add, like, he was very patient and carefully listening to the sisters, but somehow he could not convince that, like, if they take the patient to any other hospital.
Hold on, Semil, don't go to the what he could have done. Hold on. I don't want to come to that. I just want to know what he did good, because it takes courage to, sit in front of everyone and take the responsibility of doing the role play. It's not easy, because you are going to be judged. You are going to be commented on. Somebody is going to say, "Oh, you could have done this. You could have done this. You should have done this." But when you are in a situation, it's not easy to come up with those ideas. That's what we
One
want.
thing,
Yeah,
one thing I liked about Vijay is he didn't lose his cool and he was very
yeah,
calmly listening. He didn't
yeah.
become aggressive or saying that. I have seen a couple of people saying that, Arey, are you aware about your patient's health? He or she will die if you move from this spot to other. So he didn't
Absolutely.
use that sort of
That kind of threat. Yeah,
triggering language. He didn't use. He used an
absolutely. I
uh,
completely.
yeah. So that language has is a very
Yeah,
positive thing that
yeah,
will
yeah.
have.
Language, tone of voice, body language, I think all three were apt. They were really good. So, Dr. Bijoy, if you were given a chance to do this role play once again, anything that you think you would do differently that you missed at that time? Because I know it was suddenly, so naturally you wouldn't be.
Yeah, ma'am. It's like I was actually trying to refuting their claims in a polite way, because I was having stressed regarding, because their need was to take the patient towards another hospital without against medical advice. So that part I haven't conveyed and tried to say that won't be wise in a better way. So I actually I didn't do that part. So if I get a chance, I think I will explain about that part as well.
Okay.
That's all.
These people, they were patients' attendant and they were patients' daughters. So I believe they must have been around for the last 3 days also, and they must have been coming in and out of the ICU. And you being the ICU doctor, you are there 24/7 or like whenever you are on duty. So is there a possibility that you would know them and you would know their name? And knowing their name, would that have helped you?
Yeah, sure, ma'am. Yes, yes, yes.
Because when you know their name and when you call them by name, they suddenly feel connected that, oh, the doctor knows my name. So that itself gives them a lot of calming effect, that, oh, I have to behave well. The doctor knows me. So I need to. And then also asking them that why do they, first of all, I think they never came up with Lama. You knew the case, so you started with the explanation why Lama. But had we asked, why do you want to go Lama? क्यों लेके जाना चाहते हैं? Do you think that would have given us an idea about? See, this is one thing I request all of you to start implementing. I mean, it has even come to me with a lot of difficulty, because we start talking and discussing and sharing what we want to say. Ask, ask. The moment you will ask, you will know what your client wants. The moment you ask, you will know what you are dealing with, what their concern is. So maybe what I'm going to do the same role play with both the daughters, and I will be the doctor on duty. So let me see, and I want you to observe now what all I do in terms of my language, paralanguage, and body language, and what techniques I use to connect with them and then help them see the disadvantage of going Lama. And then how do I handle their question? So Anandita and Raminder, you be the way you acted with Dr. Bijoy, and I mean you can be even more aggressive if you want to be. There's no problem, but we want to show and learn that how we have to handle a situation so that we can understand their concern and address it. So can I request everyone to switch off your videos for maybe 2-3 minutes, not very long. और ज्यादा जिद्दी नहीं होना है, जो रिएक्शन आ रहा है वो देना है आप दोनों ने, मतलब डोंट बी फसी कि नहीं मुझे तो वो करना है, बट वी वांट टू सी. So I assume I'm in the ICU and both of you have come, you have entered the room. My staff said that you both want to see me and I see you in my visual field. And जैसे ही मैं आप दोनों को देखती हूँ तो मैं कहती हूँ, Anandita, you are Sunita's daughter. Am I right, Anandita?
Yes.
रमिंदर
Yes, ma'am.
आप भी, रमिंदर आप भी उनकी बेटी है ना, दोनों आप दोनों उनकी बेटी हैं. हाँ, आप अनम्यूट करिए अपना डिवाइस, रमिंदर.
Yes, I am also her daughter,
Yeah.
and we are very angry, Dr. Indu. We are very angry.
And upset too,
We do
ma'am.
not know. We are very upset that what is happening to her mother. It is that
आप
her
आओ,
condition is
एक मिनट,
deteriorating.
आप बैठ कर बात करो, मैं आपकी पूरी
मैम
बात सुन.
बैठने का आपको लगता है अभी मन नहीं कर रहा है कुछ भी, मम्मी का तबीयत ठीक नहीं है मैम.
No, her condition is deteriorated so badly. She came walking to
अब
the
क्या सोच के आए
hospital,
थे?
and now she is getting into multiple organ failure and all that you're talking about. How is it that instead of her condition improving after coming to the hospital, it is just deteriorating?
We
Raminder,
got such good
one second.
feedback about this
Anandita,
hospital.
Anandita, 1 second. I'm
Yeah.
sure you have a concern that you want to resolve. There is something that's bothering both of you. I can sense that. Can I request you to sit down and talk to me? Because unless I will understand your concern, I will not be able to respond to you. So I request, sit down, talk to me, and what has brought you to me, please talk to me, and I will definitely try to understand and help you. Tell me, please.
My mother, ma'am, doctor, can I tell now?
Sure, please go ahead.
We
Yeah.
had come here with a lot of expectations based on the feedback that we have received. We thought this is the best place where my mom is going to be all right. But to our surprise, we are taken aback. She is not only improving, rather deteriorating. We have planned to take her on Lama. Ma'am, we can't continue like
Anandita,
this.
Anandita. So you have brought 2 points. One is that you are disappointed with the condition. I completely agree with you. In the last 3 days, there hasn't been much improvement in her condition. I completely agree with you. Second thing that you said that you want to take her to another hospital. So if I may ask you, why do you want to take her and where do you want to take her?
Madam, Dr. Indu, she is not improving. We don't find she is deteriorating. And see, we find it so difficult when we talk to the people. We want to know, we want to be updated. We are being told that please wait. Doctor is on the round and it will be only once in a day that the doctor will talk to you. How we can
Raminder,
just keep
1
waiting?
second. Raminder, 1 second. I completely agree with you that her condition is not improving. She's deteriorating. And I think this we have regularly updated your whoever is there when we update. Twice in a day, we call the family member who are in the waiting area. We call and update them, and I can show you on record. Yesterday evening, also, there was somebody, Mr. Ramesh. Probably both of you were not there. Usually we try to call the first family members, but when there is nobody, whoever is there, we call and talk to them. And we have updated that person. It is written. I written in the record that it was Mr. Ramesh. Is he related to you? Is Mr. Ramesh is related to you?
Yeah, he's our cousin.
Yeah. So he was there and we updated him very clearly. And I completely agree with you that she has had multi-organ failure. She's not improving. Her health is actually deteriorating. And things are really not very nice. I completely agree. If you want to take her out, as you said that you want to take her out. First of all, you told that you want to take her out for you think that the treatment is not going well. Probably taking her out will help you. I'm ready to make a short summary about her condition and whatever treatment we are doing for her. If you want to go and discuss with somebody, show them this summary, ask them, are they going to do any other treatment than what we are doing? You can more than take her. Second thing, the condition she is in, it won't be very advisable to move her in this stage because taking out from one hospital and going to another hospital would take you 3 to 4 hours. Ask me honestly, she's not in that state to be moved from one care area to another. If you want me to speak to any one of your doctors, suppose if you have any doctor in your family or you know somebody I can explain to them the condition because when she came in, she already the multi-organ failure had already set in. The blood that she vomited, that itself was an indication that she was bleeding inside. And that bleeding had affect all our organs, right from the brain to kidney to heart to lungs to everything. And if you see the X-ray, it's completely full of shadows. I'm really sorry. I know you are very upset and you were expecting improvement. Even we are doing the treatment with the hope that she might recover and she might respond to the treatment.
Do you think she's going to get out of it? Tell us very clearly.
Ask me honestly, I have no way to tell you that it is 100% sure that she's going to come out of it. But whatever treatment should be given in such kind of cases, whatever the standard treatment protocols are prescribed, we are following exactly the same treatment. I can give you the summary of what we are doing, the condition she came in, the condition now, and the summary of what we are giving as a treatment. If you want to go for second opinion, you're more than welcome to, take the summary and discuss with somebody.
We have a family doctor. If we make a call, and will you be able to talk to and discuss?
Sure, why not? Why not? I'll be more than ready to do it, because you need to have that because if you will not have confidence in my work or my care, then I will always be, on defense. More than you, even I would want your patient to recover, because we are looking after the patient. But I hope and I wish that she responds to the treatment.
You only hope, na doctor. You can't guarantee.
There is no guarantee, Anandita. I wish, there was a way that we could guarantee. It's how her body will respond to the treatment. I can assure you that what treatment needs to be given is being given. Thank you. Can I ask everyone to come in? So what do you think I brought in this situation that worked in my favor?
So, Dr. Indu ma'am, first of all, you
One person,
addressed
1
them.
point. Sorry. Yes, Aparna, go ahead, please.
Dr. Indu, you started first you addressed them with their names.
Yes.
So that was first point, which made them feel connected to you.
Yes. That's true. Thank you. Yes, Abhishek, go ahead.
I think by getting a bit by addressing with their names, you made them feel more connected.
Mm-hmm.
Asking them to sit, take a breath, that helped them, that pent up anger just, I think, dissipated in that couple of seconds.
Mm-hmm.
And also, I think letting them know that they have options, and if they choose to exercise any option, these are the ways to go about it. It's not like you don't have to take a knee-jerk reaction. You can think about it and you can make an informed choice about it. So I think they felt more empowered.
Thank you. I think that was that was probably what was the whole approach about. That my duty is to let them know whatever they do, these will be the consequences. And I'm ready to help them. I would facilitate whatever decision they take. I am with them on this. Thank you. Yes, Dr. Som, please go ahead.
First thing is about setting space for them to sit down, calm them down, and addressing them by their names. So I think that will help to have in one-on-one conversations. So both the doctor as well as the patient relative sitting across the table and setting a scene to discuss. So that will automatically bring, if we sit seeing each other, that brings in an indirectly a psychological way, saying that we both are equal. We are on the same page. We are going to discuss same things on the same page. We are not on different pages. That was one thing that was very good about it. Second thing is understanding the perception of the relative. Why they're angry, what makes them upset, why they want the patient to be taken against medical advice. So what is their concern? So identifying the perception about what the perception of the relatives that's regarding the treatment or the management in ICU. So that's one. That's a very good approach. Then the third one is invitation from the inviting them to find out or asking them what they would like to know. What is the deficiency in care that you're feeling or that's making you to shift to another hospital or against medical advice? So probing on that will help us in understanding their needs or their concerns so that we can address them in an appropriate way. And the most important thing is knowledge sharing. That I have done so and so things for the treatment of your patient. This is what I have done for this situation or symptom, and this is the response. So I can give you a summary about what has happened so far. If you are free to discuss this with any doctor in the world, and I'm treating it, I'm treating with the international standards that such a patient will receive in any hospital. So that knowledge sharing in plain language that the patient's relatives can understand will obviously make them think a lot, and they will be satisfied that the patient is getting an appropriate care and treatment at our place. That's a very wonderful thing that as a physician we need to do. And empathy, respecting the emotions, how they are upset, why they're upset, even small things. They were even not willing to sit down in the initial phase that when you ask them to sit and speak, they were not willing because we are upset, we are angry, we cannot sit, we are not. So respecting them, their feelings, their emotions, and having empathy towards their feelings, that will automatically calm a patient's relatives. So that will facilitate in further having discussion about them. And more importantly, summarizing, like we have done the treatment part, summarizing the treatment part. Your patient came with vomiting and blood. There was lots of blood collected. The patient became sick, went in for multi-organ failure. And we are initiating this. We have initiated this treatment. That treatment is not working out. We are going to try this. So summarizing the treatment plan and then keeping them updated about their plan and deciding what we will be doing next if this plan fails. If plan A fails, what is our plan B to do for your patient? So if I think you have summarized all these things in a very beautiful way. So I think that's what I observed seeing this.
Thank you. Dr. Purnima, I think you wanted to add something to it.
Yes, madam, but Dr. Som has covered almost everything. So my points have also been covered. So I'll put it in a different way that the main observations in your very excellent way of dealing with the situation S was to have two S's. One is soft skills and second was science. Ultimately, a disease has to be dealt with a scientific approach. You are the person who is scientifically treating the patient. So what really the deal clincher was going with the option that they wanted to exercise and being democratic about it. That you want to take your patient to somewhere else, going into it with the whys of it. Why do you want to take? Making them understand that this is the natural progression of the disease. Quoting a few statistics, one more S would help, that this is so many percentage of patients develop this kind of complication, and that standard, one more S, that standard treatment protocols are being applied. But being democratic about it, sharing a summary, asking them to avail more input, scientific input, and then and most important is telling them what are the risks inherent in transfer of a patient with multi-organ failure. That transfer would add to the risk, not take it away, and what can be done is being done. And the best part in the soft skills, according to me, was that, ma'am, you quoted that yesterday I had spoken to your cousin and very particular enough to tell the name. So it's not that there is no information sharing, one more S. So all the S's have been covered, namely information sharing as well as science. And third is being democratic about it. And hence the deal has gone ahead in a very nice way. Thank you, ma'am. You've made my work easier. Role play is covered today.
Thank you. So I felt that I think these are the ways we learn from, doing two set of role plays, one done by you, because that's how you have all been doing. But if you could integrate these skills where you make them feel comfortable, make them feel part of the team, and you are ready to address their concern, and you're open to discussing, and you're open to second opinion, ready to talk to their family doctor, all that, these are the ways to win their trust. And why not? And when you do this, automatically they will have this trust that you are being transparent and honest and kind and nice if the patient is not progressing, because it is the disease that's causing the disease. It is not the doctor who is failing to do the duty. I think that communication has to be made clearly to the family, and then documenting whatever you communicate. When they said nobody's updating us, I showed them the case sheet. I said, see, last evening there was Mr. Ramesh and he was updated. Usually we try to talk to the first family member, but whoever is there, we call and we talk to them. And had they talked to me about the family or the nurses not allowing the patient to be seen, or the guard is very rude, I would apologize. And I'll say that I'll definitely communicate to my nurses and my guard to be more considerate about you, and I understand your mother's condition. And I would definitely tell my nurses and my security guard to be more humane with them, because their family member is critically ill and we don't know and we know the prognosis, it's very, very poor. So all the more important to be more human in such cases. So this was just to help you understand what I talked about in the last class, that is assertive communication. Throughout, I was using assertion. I wasn't scared of them. I was not disturbed. I was not on defense. I answered their questions. In future, if they become aggressive, I will also show how to handle that aggressive behavior. But I knew if I would be aggressive, I can calm them down. I want to reiterate here, please make use of the cognitive process called mirroring. It's a very, very important skill. If you want people to calm down, you will have to show how to be calm down. You will have to demonstrate how to not to get angry in a situation where usually people act aggressively. So the moment you will stay calm, you will be nice, kind, and compassionate, automatically they will start mirroring you. So rather than you mirroring their behavior, stick to your behavior and they will mirror your behavior. So mirroring is a very good way to, change people's behavior and attitude. But you have to be in know of it and should have good hold on it and stick to it. Because aggression fuels aggression. When they are aggressive and you are assertive, they are bound to calm down. Raminder and both Anandita could not be aggressive with me because I was respectful, I was nice, I was polite, I was ready to talk, I was open to discussion. So they had no reason to. And then they said treatment is not being done. What do you know? What do you know about treatment? Are you doctor? Had I said like this, gone case. I said, I'm ready to give you a short summary of what we are doing. You can discuss with anybody. If you want me to speak to any of your doctor, I'm ready to talk. So these are the ways where transparency and honesty gets demonstrated. Democracy also gets demonstrated. You chose very good words, Dr. Purnima. I think that was very well, explained when you explained that. I mean, sharing and also showing and also empathy. I think everything I was trying to showcase that, and that's what is required by one and all. You can actually handle most of the situations if you can bring all this in your conduct with you. So at this stage, I'm going to show you 4 videos. These are my homemade videos. So please pardon me for the quality of sound or maybe some disturbance in between. But I'm going to show you same situation handled with 4 different communication styles. So one is passive communication, then passive aggressive communication, and assertive communication. Situation will be same. So you will get a fair idea how we need to really, stick to assertive communication. So I'm showing you the first video. Is the video with, the screen visible to all of you? Okay.
मैम मैं ना हाँ जी मैम वार्ड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं कहाँ दूसरा हॉस्पिटल जाने के लिए कह रहे हैं उनके जो रिश्तेदार
Give me 1 second. Give me 1 second. I will open in BLC. I think that would work better.
मैम मैं आ जाऊं?
हाँ जी।
मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं।
कहाँ?
दूसरा हॉस्पिटल जाने के लिए कह रहे हैं, उनके जो रिश्तेदार हैं।
क्या कह रहे हैं?
कह रहे हैं मैं डिस्चार्ज करता हूँ, दूसरा हॉस्पिटल जाएंगे।
वो जो उनका बेटा है,
हाँ जी,
जो उनके
उनके
साथ
साथ
रहता
जो
है,
है ना,
जो
वो कह रहे हैं वहीं किस हॉस्पिटल में जाएंगे। एक बार आपसे बात करा दो, बात से लिसन कर दो।
जाने दो, क्या करना है, कौन से सफाई करेगा, छोड़ो करो। डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे, आप अपना बिल क्लियर कर लेना, चले, ठीक है, बना दो डिस्चार्ज स्लिप, बनवा दो। So what did you observe in the video?
Not
Yes.
concerned.
Not concerned. Yes. Yes, Dr. Abhishek, what do you want to say?
Yes, obviously not concerned, and it doesn't really matter who stays, who goes, what happens. My day will go on. So it's like that.
Yeah. So not concerned, not ready to take responsibility, not ready to talk or to explain or make an effort. So this is a very clear example of passive communication, where you don't take any stand, you don't want to talk to the patient and family, and when you know there can be an argument or any discussion. So I'm showing you the second video, which is passive aggressive communication.
मैम आ जाओ। मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं।
कहाँ जाना है?
दूसरे हॉस्पिटल जाने के लिए कह रहे हैं, केवल डिस्चार्ज कर दीजिए, दूसरे हॉस्पिटल जाना है।
कौन कह रहा है?
उनका बेटा साथ में जी।
वो जो हर टाइम उनके साथ रहता है।
हाँ जी।
वो है ही बदतमीज, वो बिल्कुल बेकार आदमी है, हर वक्त कुछ ना कुछ उसको नया ही सोचता है। अब क्या कह रहा है वो?
डिस्चार्ज कर दीजिए, हम दूसरे हॉस्पिटल लेके जाएंगे।
तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा? क्या यहाँ पे इनको क्या तकलीफ है? क्या कह रहे हैं यहाँ पे, क्या दिक्कत है उसको?
कह रहे बस हमारे डिस्चार्ज कर दीजिए, हम दूसरे हॉस्पिटल जाएंगे।
नहीं तो वहां पे क्या, यहाँ पे इसको क्या दिक्कत आ रही है, कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको?
नहीं, ऐसा तो कुछ बताया नहीं।
कुछ बोला नहीं। अरे ये शुरू से ही ऐसे ही बोल रहा है, ये वहां तंग करने वाला बंदा है, किसी काम का नहीं है। भेजो, ऐसे बंदे से क्या करना है हमने, और लड़ाई करेगा, जितनी देर ये यहाँ रहेगा तंग नहीं करेगा। कभी मेरे पास आता है, कभी कहते जी सिस्टर ऐसे कर रही है, कभी कहते हैं जी सिस्टर वैसे कर रही है, कभी कहते हैं जी पर्दे नहीं ठीक है यहाँ पे, कभी कहते हैं जी एसी नहीं काम कर रहा आपका, बार बार कंप्लेन ही करते हैं। भेजो इसको, और डॉक्टर राकेश को बोलो इसकी वो बना दे।
बात कर लीजिए।
क्या बात करनी है, बदतमीज आदमी है, जाने जान छूटेगी। कुछ बोलना मत उसको, उसको कह रहे हैं ठीक है बना देंगे। डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर देना अपने। ये जो जाने दो, ऐसे लोग जाए ना ही रहे तो अच्छा, सारा दिन सिर खपाई करनी पड़ती है किसी से, ठीक है। तुम्हारा क्यों मुंह उतर गया? जाओ जाओ जाओ, जाने दो।
मैम आसू, मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं।
So could you see the passive aggressive style of communication?
Yes.
She wasn't willing to talk to the patient or family, but with the staff, she was talking all ill about the patient's family and
All bad mouthing.
at bad. So in passive aggressive, we are upset, we are annoyed, but at the same time, we don't want to address the concern. So we see this kind of behavior also very often among people who would not take any stand, who would not address the concern, but they will always, talk bad in the background. Yeah. So let's see the third video, which is aggressive communication. क्यों?
वो डिस्चार्ज मांग रहे हैं, कह रहे हैं मैं छुट्टी कर दो, हम दूसरे हॉस्पिटल जाएंगे।
फिर क्या तकलीफ है उसको?
तो कैसे छुट्टी करता हूँ मैं दूसरे हॉस्पिटल जाने के बाद।
यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो आ गया तो क्या करेंगे?
उनके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे भी साथ बना।
उसका जो बेटा है जो उसके साथ हमेशा बैठता है, यार बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतने नखरे इतने हैं, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो छुट्टी कर दो।
आपकी बात कराओ।
भेजो उसको, जरा सही करो उसको, भेजो जरा। क्या तकलीफ है भाई, क्या हुआ है? मैम डिस्चार्ज कर दीजिए अभी। तुम्हें उनकी हालत पता है इस वक्त क्या है? बहुत दूर पड़ता है, आने जाने में दिक्कत होगी, इसलिए आप डिस्चार्ज कर दीजिए। नहीं तो हॉस्पिटल तुम्हारे घर के पास ले जाऊं, डिस्चार्ज कर दो। उनकी हालत इतनी खराब है, रास्ते में कुछ हो हवा आ गया ना इधर के रहोगे ना उधर के रहोगे। ज्यादा दिमाग मत चलाओ अपना। इलाज करवाना है तो शांति से करवाना चाहिए, ऐसे नहीं कि इधर भागो उधर भागो। मैम इधर आने के लिए ठीक से लगता है, और इधर आते भी बहुत ज्यादा भीड़ हो जाएगा, तो पैसे है नहीं हमारे पास। तो पहले ही सरकारी में चले जाना था, यहाँ आने की क्या जरूरत थी फिर? आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना कि ठीक से इलाज नहीं करा उन्होंने, मेरा भी नाम खराब करोगे, रास्ते में पेशेंट को कुछ हो गया और मुसीबत हो जाएगी। आप डिस्चार्ज कर दीजिए भैया, बहुत ही बेकार आदमी हो तुम तो। डिस्चार्ज तो मैं कर दूंगी, पर दोबारा मुड़ के मेरे पास बताना। ये कोई तरीका नहीं है इलाज कराने का। अपने पेशेंट का भी नुकसान करोगे और मेरा भी नुकसान करोगे साथ ही साथ में। हमारा आदमी है। सिस्टर,
हाँ जी।
इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका, तब भेजना है इनको। जाओ, और दोबारा मुड़ के मत आना मेरे क्लिनिक में। कहाँ कहाँ से लोग आ जाते हैं। What is your observation about this video?
Ma'am, I think that guy is so lucky that you didn't manhandle him. I was fearing that.
Even though you were aggressive, you were not getting aggressive so much.
No, but then I was aggressive right in his back and also on in front of him. I was shouting at him that should I take the hospital close to your house to treat your patient?
But your body language was still not so much aggressive as we
Yes.
sometimes see also.
Madam, I
Yeah.
should compliment you on your superb acting skills, ma'am.
So you could see how I was, directly being aggressive with the patient party, not ready to understand their concern. I was using sarcasm. I was commenting on him. I was disrespecting him. And that's how sometimes we don't become physically aggressive, but verbally and body language wise and tone of voice completely becomes disrespectful. So let's see the last video, which is
Madam,
about.
one observation, please.
Yes, please go ahead. Yeah.
The patient's relative who was sitting was
Mhm.
not actually that aggressive. And
Wow.
imagine how the situation would have escalated if he was aggressive in speech or behavior.
Absolutely. And that's what exactly happens. When we are aggressive, chances of the family becoming aggressive becomes very,
Yes,
very
ma'am.
common. And especially if they are in numbers. If they are 2, 3 in number, then definitely you can expect, and that's what turns into violence ultimately.
Yes.
That's what turns into violence. Yeah. So let's see the last video, how she could have handled in this manner and managed it well. Yeah.
मैम आ जाओ इसमें। मैम घर नंबर 7 स्टेशन जाने के लिए तैयार हैं।
कहाँ जाना चाह रहे हैं?
दूसरे हॉस्पिटल।
छुट्टी के लिए कह रहे हैं?
हाँ जी।
जो उसका
उनका
बेटा जो साथ में वही
हाँ
होता है
जी।
उसके पीछे। भेजो उसको, मैं एक बार इससे बात करूं। भेजो। आ जाओ, बैठो। भूपेंद्र नाम है ना आपका? आप उनके बेटे हैं? जी। क्या हुआ बेटा? जी मैम डिस्चार्ज कर दीजिए। कहाँ ले जाना चाहती हो? जी मैम किसी दूसरे हॉस्पिटल में ले जाएंगे जो अपने घर के पास में होगा। वहां से आने में बहुत दूर पड़ता है और जो पैसा है उतना है नहीं, मैम आने जाने में खर्चा बहुत हो जाता है। देखो बेटा, अगर आप कहोगे छुट्टी कर दो, मैं कर दूंगी, मुझे कोई दिक्कत नहीं। और मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है। क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे तो रास्ते में एम्बुलेंस से लेके जाओगे, कैसे होगा कुछ नहीं कह सकते, क्या सिचुएशन है कुछ नहीं कह सकते। मतलब हालत इतनी अच्छी नहीं है, ठीक है। थोड़ी भी ठीक होती है तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं, तो हमें काफी हद तक उनके बारे में पता है, क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से वो इलाज करेंगे, मैं बेशक तुम्हें पर्ची बना के दूंगी, उनका सारा डिस्चार्ज लिख के दूंगी, जो जो ट्रीटमेंट करनी। तो फिर भी एक होता है, डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त इनकी किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो फिर वो नए तरीके से सारा हैंडल करेंगे। तो देखो, एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना। और मुझे ऐसा भी लग रहा है कि पिछले 2-3 दिनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना। इम्प्रूवमेंट तो हुई, बट वही पैसे वाली प्रॉब्लम आ जाती है मैडम। पैसे की देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है। अगर जहाँ भी लेके जाओगे वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा, सरकारी में अगर जाओगे तो वहां पे आपको पता है, वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना। देखो, मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, जहाँ इतना सह लिया ये भी आप कर लो। बहुत मुश्किल है, लेके जाना चाहते हो फिर तो बेटा मैं जिद तो नहीं कर सकती तुम्हारे साथ, ये तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना है। जो भी करना चाहो तुम कर सकते हो। पर मैं कहूंगी ये कि घर पे एक बारी सलाह कर लो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो। क्योंकि मेरा कहना ये कि जो 2-3 दिन की बात और है, जहाँ हफ्ता निकल गया फिर 2-3 दिन की बात है। फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं, मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, जहाँ खर्चा कम है, फिर जाने ले लो। जी हाँ, वैसे आपने तो सही कहा, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम, और पता करता हूँ कि 2-3 दिन की और बात है, और इम्प्रूवमेंट भी अच्छा हो रहा है उनका। तो शायद हो सकता है कि खर्चा थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो। देखो बेटा, हॉस्पिटल में भी खर्चा तो होता ही है, ये तो है नहीं कि फ्री कहीं काम होगा। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा। प्राइवेट में जाओगे तो 19-20 का फर्क आएगा, ऐसा नहीं क्योंकि जमीन आसमान का। फिर भी आप सलाह कर लो, मुझे बता दें, ठीक है। थैंक यू। अच्छा, so I think the idea of 4 videos was to show you how different behavior will bring in different results. So what I want you to pick from the videos is the body language, the tone of voice, selection of words, and also understanding their concerns and empathizing and being okay with whatever they decide. See, a lot of time they will not agree with what you want them to accept. We have to learn to be okay even with that. Only thing is we communicate honestly and openly to them, and then we'll let them decide. So any questions about whatever we have discussed till now about the role play and also the videos? So if no questions, we move further, and I'm going to again discuss further assertive communication, because this is one skill we have to really use in all situations, and you will see whether we'll be discussing managing and resolving complaints, which will be the next topic, and then handling aggressive patient party, breaking bad news, disclosure of medical error. Everywhere these skills will come handy, and you will be able to handle any difficult situation with these skills. So I'm going to share small presentation on assertive communication to understand these skills in depth. So as I said, we handled disagreements and difficult situations in various ways. And if you remember your own scores, We all use things like passive communication, passive aggressive, aggressive, and assertive communication. But usually, when we are using passive style, we are actually going to not take a stand, keep quiet, and we don't normally express what we are feeling or what we want to tell or what we think is right or wrong. So usually we put ourselves down in front of others because we think that we don't need to, communicate what we want, or our needs are less important than others' needs. So people who use passive communication, you will see that they would sometimes apologize often, and they'll be usually on defense, and they'll feel that, if they disagree with others, it will be uncomfortable to handle that. So they are more likely to agree with others and align themselves with others rather than expressing what they are feeling. So passive communicators, you will see that they will allow their rights ultimately to get violated by others because they don't express their feeling. Also, the agenda on their mind is to avoid conflict because they don't want to get into any kind of conflict with anybody. So they will look for an escape route to avoid any conflict. So often they will not share their honest opinion, and they will also not defer to others' opinion because they will agree with others. That's the thing I'm trying to say. There's always a fear of rejection, helplessness, frustration, and anger. Because definitely, if you don't express yourself and if you don't come out with your honest feeling, you will definitely feel frustration and anger. And there's a fear of rejection and helplessness that others might not approve my opinion or may not like my opinion. As a result, there will be resentment towards others, saying that they are using me, they are not, giving me my due rights. And automatically, the self-respect also will get reduced. It will affect a person's confidence, self-respect, growth also will get affected as a result. So I'm going to show you one situation in which a nurse who is a passive communicator, and she is interacting with the doctor who is aggressive. So just look at the situation and you will understand what exactly I'm trying to say. So in this, Dr. Rakesh is on round with nurse Jolly, who is a passive communicator. So Jolly says to the doctor, the patient's sugar levels are high. About one patient she is communicating. But the doctor is aggressive and he says in a loud and irritated voice, don't tell me what to do. I know how to manage my patients. Just follow my orders. That's what is expected of you. So since she is passive communicator, so she immediately apologized and she says, oh, I'm sorry. I'm really sorry, doctor. I should not have spoken out of turn. And after that, there is no further information volunteered by her because she got snubbed. So she felt that, I mean, the moment I'll open my mouth or say something, I will be snubbed further. So let me not just speak up. And as a result, you will see if you have that kind of, environment where one person is aggressive and the other staff member is passive. So naturally, there will not be an open and honest communication. There will not be any two-way communication. Chances are people will hide things from the person who is aggressive nature, and especially in an authority position, and people will not come out openly and honestly with them. The other way that we see people handling situations is passive aggressive. So people who are passive aggressive, they would normally, they'll fail to take any stand. They will not open up again. They will not take any responsibility. They will also feel that I will be rejected if I assert it. So basically, they don't want to assert because they feel that I don't want to, handle conflict. But definitely there will be resentment, inside. And also, they would always say that I'm being used by others and others are more demanding to me. And there always will be a fear of being confronted. So if I say something and if the other person is not okay with my idea, I'm going to be confronted. So you will see they will not, come out with their opinion or thoughts or expression. So people who are passive aggressive, they will usually forfeit their rights initially because they don't want to express themselves, but they will not stop there. It will be followed by manipulation and vengeance. They would talk ill about you or the situation or people in their absence. So goal of this style is also to avoid conflict, but then make the other party wish that they had seen in their way. So basically, they want to make the other person feel that I am not given the chance or opportunity to express or to take responsibility. So they will behave passively on face, but later aggressively when the other person is not around. And you will see them using sarcasm very often in their interaction. So I'm taking the second example. It's again Dr. Rakesh who's aggressive, but the nurse here is passive aggressive. So same situation. Prema, she says the doctor, the patient's sugars are high. Aggressive Dr. Rakesh says the same thing once again. Don't tell me what to do. I know how to manage my patients. Just follow my orders. That's what is expected of you. So Prema, who is not passive aggressive in nature, she says, "Okay, doctor." And then talking to herself, she says, what does she say?
You fool, wait until my time comes.
Yeah. So I could not read it. It was covered with the picture. Yeah. So he says, "You fool, wait until my time comes. I'll make sure a patient complains about your incompetence." So she's revengeful. So she's going to manipulate things and create, a problem for the doctor, but not going to talk to him directly. The third way that we handle situations is active aggression, where we use aggression as a way of, dominating others. So you will see people who are aggressive in nature, they'll try to dominate the discussion and they will not let others share their thoughts or feelings. So usually they will have this idea that I have to win at all costs and I'm always right. So that's their opinion about themselves. They will protect their rights at the expense of others. And they also, do not consider the consequences of an action. So as a result, you will see a lot of time they have to face adverse consequences because they overstepped their role or responsibility or behavior. So in terms of their eye contact, you will see them usually looking very angry and intimidating. They'll never defer to others and they'll try to control others and situations usually. Lot of energy you will see in them. So especially when they'll talk, their voice would be, loud, and they will belittle others. They will use verbal abuse and also use violence against people. So again, an example of the same situation where they're in round and nurse who is aggressive in nature, she says the same thing to the doctor that the patient sugars are high and you haven't said anything about that. Now aggressive doctor who is irritated, he says, "Don't tell me what to do. I know how to manage my patients. Just follow my orders." That's what is expected of you. Now, aggressive nurse in a loud and irritated voice says, "Excuse me, doctor. I'm also a part of the healthcare team. You have no right to talk to me as you just did. I'm going to file a complaint at the nursing office against you." So now she is also acting aggressively. Usually we think these are the three ways we can handle this situation and we try to, handle in this manner. But assertive communication, again, repeatedly, I'm saying these skills can help us handle most of these situations amicably. We just need to be a little more open, honest, positive, confident, and respectful. So when you assert, the chances are you will protect your rights, but you will not violate others' rights. You will also respect others' rights. The goal in assertive communication is that you will communicate with respect and also you will try to understand other person's point of view. You will try to understand what do they want or what is their need. And then you will try to find a solution to the problem and thrive for win-win situation. So you will see assertive communicator usually would maintain eye contact with the other party. They will present their wishes clearly and respectfully. They are confident and strong and yet flexible. They would be open to listening to the other person's point of view, and if they think the other person's point of view is okay, they would be open to even accepting that. They are objective and they do not easily get overwhelmed. They would listen and validate others, whether their feelings or opinion. So benefit of assertive communication is you will see that there is no accumulated anger because one is able to express their feelings and thoughts in an open manner. So you will see relationships would become better and transparent. Others will also take your opinion seriously because what you talk would make sense to them. It also will earn you respect and credibility in your team and in family as well. There's a reduced risk of exploitation and abuse, and life becomes easy and stress-free. So the last example, same situation, doctor is aggressive, but the nurse here is assertive. So again, she says the same thing that, doctor, I wanted to tell you that when I checked the sugars of the patient, they were high. Aggressive Dr. Rakesh says, don't tell me what to do. I know how to manage my patients. Just follow my orders. Now, assertive Asha says, I'm sorry if what I said looked like I was questioning your ability. This isn't what I meant. It's only in the best interest of the patient that I would like to know the plan of action for the high sugars. Aggressive Rakesh says, okay, start insulin. But remember, I'm the doctor here. You just need to follow my orders. And that's what is expected of you. Asha says, you're right. You certainly are the treating doctor. It's just that being a part of the healthcare team, I need to actively participate in patient care too. So you see, when you stay confident, but you are respectful, usually you are able to communicate effectively. So people who are assertive, they will look after their need and they will also respect others' needs. So just to conclude, I think two elements, if we can keep in mind when we are communicating, one is openness of communication and then consideration of others. If we can remember these two things, you will see when you are high on openness of communication and you're high on consideration for others, it will be an assertive communication and it will create win-win situation. So this is in nutshell about assertive communication. So this one skill we will be using in all future communication sessions. That's why I thought I must give you an overview of these skills. So any questions about what we have discussed about assertive communication? Is it making sense? Is it clear? Is it giving clarity?
Yes.
Because a lot of time we think assertion is being firm on what I'm saying. It is not being firm. It is rather being flexible, where you have a dialogue with the other party. You're open to listening. You're open to agreeing. You're open to understanding. That's assertion. But when you speak, you clearly communicate what you think or feel or you want to see. That's the whole idea of what assertion. So before we go for the presentations by the, today we have 3 presenters. 3 people are presenting, yeah. So maybe we have 5 more minutes to 9:30. Do you want to do any other role play? One more role play? If anybody wants to bring in any situation. If you want to take any situation from HR, we could even take that. Because that was with patient. But we have people who are uncooperative, who are not very responsible. So we could even take that situation as one for the role play. Quickly for 5 minutes maybe.
Ma'am, in HR, what we experience normally, especially for the consultants or even the junior medical services profile, or maybe others also, if they are not happy with something, suppose they have some expectations, like they have an expectation related to, let's say, about the increment part, and which has not happened, the renewal part. So in that case, they become little aggressive, and when their expectation doesn't match the reality, so they become aggressive. So we have to handle the way you told, like in a much assertive way, and then the communication has to go clear, that why we could not go beyond it, or what was the reason behind why we were not capable of doing so. So that is how we handle, ma'am.
So at the end, is the person who has brought up this issue satisfied and convinced and happy?
Yes, ma'am. That is how what happens, ma'am. In HR, the team members, when they are unable to make, they escalate the matter to us, and then we handle, ensuring the things, the employee is satisfied with the answer that we give, and it's like either they take the contract renewal form or depends upon the situation. So finally they agree to what we ask them to do. Most of the case, in 99% cases, that is what it happens.
Okay. Thank you. Any other situation that you want to take, that you think you want to take for the role play? Or Anandita, if you think you have been doing it well, would you like to demonstrate how do you do it? It will be learning for all others.
So, ma'am, yesterday only, I'll tell you something, like we have a new diagnostics that has come up with us, and then we have to shift some technicians to that particular diagnostics, keeping in mind all the privileges would be given. But definitely, they were working under the roof of a hospital, under the logo of a particular hospital, and now they are moving to a diagnostic center. It was really difficult because the building remains the same, but the employer is now changed. So there were 5 such technicians whom we had to convince, and they have to give their exit letters as well as accept the appointment letters of the new diagnostic center which is in the hospital. But it was for the benefit of the organization only we were doing, also taking care of all the aspects. So one to one we handle. I handle with the owner of the diagnostic center who has set up his unit at our hospital. So we were very assertive about what are our expectations, what all facilities we are going to give. Also, we assured them that all the facilities that they were getting in this hospital, although those facilities are not enlisted in that diagnostic center, but since they are moving out and joining there, those things remains the same. So it was a very difficult, almost I took 2 hours for all those 5 technicians, handling maybe half an hour if you can think for each one, and convincing on the same line. And then finally all of them accepted the appointment letter and gave the resignation letter immediately. So it was given hand in hand, one handover of that appointment letter and takeover of the resignation letter was done.
Great, great. Thank you for bringing that case. I think that's how we need to handle even, these kind of situations where you need to talk to even your team members in the assertive way. Also keeping their interest and welfare in mind, because a lot of times we are convincing and when we are persuading them, we are actually asking them to do something probably which may not be suitable to them or which may not actually be genuinely beneficial to them. So we have to be careful not to compromise their welfare and their benefit. But if you could ensure that, I'm sure they must have been satisfied with your explanation. Thank you for bringing that case.
Yeah,
so I think, thank you. So we'll go further and we'll start with the presentation, because I know we say 7-8 minutes, but sometimes it takes longer. So who is ready with the presentation first? I think Dr. Purnima.
I'll go first.
And Raminda, 3 of you are ready.
I want to go first.
Raminda, you want to go first? So I couldn't see who wanted.
I want to go first.
I'm not able to see who is saying.
I'm Aparna.
Oh, Aparna. I could not see who was speaking.
Yeah. Okay.
I'm sharing. I'm allowing you to share your screen.
Okay, ma'am.
Go ahead. Yeah.
So everyone is able to see my screen?
Yes, we are.
Okay. So good evening, everyone, again.
Has Aparna lost connection? Aparna, are you there? I think she got disconnected. Aparna, are you? Yeah. Some challenge at your end, Aparna? Aparna, some challenge at your end? We are not able to hear you. I'm not able to hear you. Can you hear me? But we are not able to hear you. I think you have connected some device that needs to be disconnected. Otherwise, you were audible. Would you like to log out and log in once again, Aparna? Yeah, log out and log in. That would be better. So I think by the time she joins, somebody else can make the presentation because
I can.
Yeah, go ahead. Yeah, Ravinder. Yeah.
Okay. Before I start with my presentation, since we have another person also and we had long session, why not we have one activity, small activity. Let everybody write, requesting everybody to write one of their strengths in communication and one weakness in communication which they like to improve. Just in 1 or 2 words in the chat box.
Aparna, I have asked Ravinder to present. Meanwhile, you can fix your glitch and then we can, next you can present after her. Mhm.
Just briefly, 1 or 2 points. You can write your strength and maybe weakness you can write later. Connecting skills, empathetic, can implement active listening, patience, need to smile a bit more, Dr. Abhishek. Waiting for the others also to respond. Dr. Anu, expressive and weakness.
Tone awareness. So we sometimes
I was not able to read that.
tone awareness. Probably sometimes you are not able to know
Yeah.
that your tone has gone little rude or authoritative. I agree. Yeah. Dr. Purnima has written her weakness, impatience when in negative physiological state.
Yeah.
Dr. Patel also talked about weaknesses, tone of voice. Yes, a lot of time we don't realize that we are authoritative or we are rude.
Similar strength is listening and can smile.
Dr. Som has written a good this thing. And that means you are aware of your being assertive and curious to listen to people. Weaknesses will end up talking too much. When you have knowledge and experience, it actually flows. So it becomes very difficult to control oneself. I completely agree with you. Wonderful. So a lot of new things have come up. Simil
Yeah.
says can smile, and weakness is lack of patience. Again, being able to talk about your weakness is not easy. Yes, Raminder, please go ahead. Yeah.
Yeah. So this was just a small ice-breaking session, which is my topic also. I'll go to ice-breaking session, just 1 minute. Is my screen visible?
Yes.
Okay. Yeah. Ice-breaking session. These are designed to facilitate introduction, and often we have seen many times Dr. Indu also using this session, and we just had one exercise also. In the beginning also, we started with our interaction with each other and small, talking and getting introduced to each other in pairing. They serve as social lubricant, and then that made us feel comfortable in the group. And we started feeling as a team. So it is often used for team building conferences, and the aim is to break down barriers, elevate tension, and foster connection between individual, and we get to know each other better. These activities often incorporate elements of fun, creativity. Where all we can use it? It can be used in workshop and training sessions, conferences, networking events, team meetings and retreats, orientation of new employees, especially when it is, introduction of each other. If it starts with that, that makes them feel connected to each other. It can also be used in classroom settings. It can be used in community and social gatherings. It can be used in team building events. Many activities like Chinese whisper and all is being used very often in team building activities, remote meetings, and virtual events. Advantages of using ice-breaking activities. One thing is it facilitates introduction. We get to know each other and we are able to understand and we feel part of the group. It creates a positive atmosphere. We all get into positive tone for meeting. It elevates tension. We are able to get connected, encourages participation. We have seen most of us quickly writing in the chat box, and most of the people get, those who may be a little reluctant also, they also feel that, yes, I can also be participating in those activities. And definitely it helps to build rapport, and it promotes team building, enhances learning. This also, like this small ice breaking activity also made us to reflect into ourselves where we are having a strength. To talk about strength is more easy, but to reflect into the weakness, sometimes it becomes more difficult. Disadvantages when we talk about ice breaking activities: time constraints. Sometimes it may take a lot of valuable time if especially the activities are too long. It may waste the time, and we may not be able to concentrate on the main purpose or agenda of that meeting or the orientation and other things. There may be some resistance or discomfort caused. Dr. Indu made us, really relax, whatever, even if he replied something wrong or something, the way the respect was given, no, it's a good attempt. So, that discomfort was removed, and now we feel more comfortable in expressing our opinion more easily. Overuse or predictability. If it is too much used or it is too predictable, then it doesn't create interest, and it looks like we are forced to write something or we are forced to do this activity. Then cultural sensitivity, especially when we are in a group, if it is certain things which are culturally sensitive, like sometimes we say that in our conferences, workshop or orientation, we say just shake hand with the person just next to you, or touching. Certain people may not feel somebody touching on them, touching hand, may not feel comfortable with that. So we have to look into mismatch objectivities. Whenever we select the activity, it should align with the overall event. It should not be going something that anything can be fixed anywhere. So you have to be very selective in which is the one which is related to the purpose of the meeting. That should be, those activities need to be selected. Limited effectiveness. Sometimes it can be when you lose the tone, and when the things do not move properly, it can be challenging. Like if suppose, we ask about, if it was in the first session, it was asked about what is your weakness in communication. Maybe it would have been more resistance from all of us to reflect on that. But over the period of time, with all these activities, people are now feeling more comfortable to talk about the weaknesses also. Certain do's and don'ts. Do's, consider the group dynamics to suit the size. When we select the activity, we need to look into it should be according to the size, composition of the group. We should be looking into it. If it is many people there, then we cannot have certain activities which may be very time consuming. Then maybe it is dividing into the groups, and then taking few people, everybody participating, and having some representative from the group to come and present. Then set clear objective. Keep it fun and engaging. It should not be very boring activity which people do not enjoy. Encourage participation. Like, we need to acknowledge the contribution. We have seen how Dr. Indo had been acknowledging the contribution and trying to involve each and every participant during these sessions also. Then facilitate discussion. Yes, what are the things you found in the role play that we saw? What were the things which were lacking? How can we improve? What are the different ways? So this is the way of facilitating discussion. Be flexible to ensure the activity remains effective and enjoyable and everybody is involved. The don'ts are, don't force participation. Sometimes certain people have their boundaries, they're very introvert and may take time to get involved. But if you force, they will not feel comfortable and it will lose the purpose of having those activities. Don't use excessive time. Keep activities concise and focused to, like saying that, try to something which can be easily done so that we don't lose the main purpose of the meeting. Don't choose inappropriate activities, like we said, culturally sensitive or which are very physically demanding. Maybe if it's a group of people, if you give lot of exercise to them, let's go for an exercise and all those things. Certain exercises may be fine, but if the people are there who are not much into it and you give them certain activities, run and come back. If it is students, we may say, okay, just take a round and come back quickly, but may not be appropriate for certain other group. Overcomplicate instruction. The instructions have to be very concise, clear, and easy to understand. If we overcomplicate instruction, then people will be lost and may not get engaged in the activity. Don't neglect debriefing. Once the activity is done, debrief and talk about what is the key insight, what is the observation. So what is it that is coming out of these activities? Don't forget to do the follow-up. It is very important that whenever we have some activity, do the follow-up and use it to go further into the main agenda of the meeting or the conference, workshop, whatever is there. That's it. Thank you so much.
Thank you, Raminder.
Yeah.
Thank you, Raminder, for keeping it short and crisp. I think
Thank you.
It's really, very well presented. I think ice breaking we all use and we should use. These are the ways to make your audience comfortable and open up and connect with each other. And we should be very innovative with the ice breaking activities, because some activities people would already know that this is what is going to be done. So you have to be really creative with ice breaking. So any questions for Raminder? If anybody wants to ask something to Raminder. Yes, please.
Yes, Dr. Purnima.
May I just compliment you on an excellent ice-breaking session on the learning activity, participation activities.
Thank you. Thank you so much.
A tough example to follow.
Thank you.
Thank you. Any more questions for Raminder or compliments or feedback?
Yes, I would like to have a criticism also on that because we are all here to improve further.
Okay, if no more questions or comments, then we can have the second presentation. Aparna, are you ready?
Yes, Dr. Indu, are you able to hear me?
Yes, we can hear you.
Okay. Okay, so can I share my screen?
Yes, you can.
Okay. So good evening, all of you once again. So today my session is about storytelling as a pedagogy tool. So the agenda goes like this. I'll have a short story, which I'll be narrating, then followed by the introduction, where it can be used, the advantages and disadvantages, and the do's and don'ts. So I'm going to start off with a story. So in India, we are blessed with a huge ocean of folk tales, which involves all the birds, the mountains, kings, etc., which deliver the nuggets of wisdom in a very engrossing way. So here I'm going to give you an example of an immense wisdom ingrained in a form of a folk tale. So as you can see, the title of my story is The Foolish King. Now here you can see two characters which are seen in the picture, a king and a bird. So the story goes like this. While walking in the royal garden, the king came upon a very pretty bird and caught it. The bird tried to bargain the freedom by promising the king 3 nuggets of wisdom. When the king agreed for the bargain, she gave him those 3 nuggets. First, do not regret what has already happened. Second, do not long for what you cannot have. And third, do not believe that which is impossible. The king thought the nuggets were good enough to let the bird go. The bird flew off the porch beyond his reach and started laughing. My freedom was cheaply bought, she said, because in my stomach is a diamond the size of the fist. The king immediately lunged for the bird and tried to lure her with promises of a royal life. The bird looked at him scornfully and said, "Forgotten the 3 bits of wisdom I gave you. You are regretful after losing me. You long to have me even though I am out of your reach. And how can you believe that a little bird like me would swallow a diamond size of your fist and still be alive?" So saying, the bird flew away. So I just wanted from you how I was in narrating the story. Were you focused or distracted? Was it powerful? So I would like to hear your comments, your criticism at the end of my session. So I would go ahead with my session. First of all, I would like to introduce storytelling. So we all know humans are storytellers. Also, it is an oldest form of teaching. You must have seen in the olden times, in the gurukuls, the saints and the sages used to tell stories, used to communicate, to pass on the wisdom and to spur the imagination of the disciples through Ramayana, Mahabharata, etc., all the holy books. Then, before the advent of the written communication, the storytelling served to pass down cultural, ethical, and other information from generation to generation. Now, it inculcates attitudes of sharing, understanding other cultures as well. Now, apart from narrating the story, the listening to the story develops skills of listening in a very natural, organic way. Also, it is scientifically proven that any teaching done immediately after telling a story is well retained. Then I'm going to talk about where it can be used, where the storytelling can be used. First, it can be used in leadership communication, where the leader aims to influence change, negotiate with the stakeholders for a long-term goal, to decide the vision and mission of the organization, and to help motivate the leaders. So this kind of leadership communication and storytelling needs intellectual winning along with the mind winning. Secondly, in the change communication, you all know every organization goes through ups and downs. The ups are very easy to discuss, but the downs, like the accusations, the layoffs, and all, it is very difficult to explain it to your employees. So here the leader can, make themselves vulnerable and honest in front of the employees, and where they can share the information which is relatable, so that they don't feel a shock, like if the employees are getting laid off, so they don't feel that much. You can connect with the audience and you communicate to them. Thirdly, it can be used in learning and development. So every training program, workshop, has the attempt to drive change, motivate, and inspire the audience, to move out of their comfort zone. Then it can also use in coaching. The coaches, they can share their life story with the audience, connect with the audience with the story. And as you all know, nowadays people are more involved in building the vlogs, the blogs, the podcasts, so they can always use stories as a message, whatever they want to convey with the audience. And lastly, marketing, very important. It educates customers about their services, the products, what they have to offer. Then we come to the advantages and the disadvantages of storytelling. So what are the advantages? Advantages, it provides a more natural context that enables the learners to explore. It has a universal engaging appeal for the learners. Along with that, it sustains interest and motivates the learners. Of course, it has a very positive learning attitude and a powerful source of imagination. Disadvantages, learners can become passive listeners if you tell the same story every time. And there is also a less active participation. The audience cannot question more, and they may not understand the session. Learning by doing is not implemented in this method. And whenever there is a shortage of time, stories, might take up a big chunk of the session where you can just lose the other bits of the training session. And lastly, it might trigger controversies and arguments. The next is some of the do's and don'ts which I would like to mention. Do's is, first of all, you have to set the scene and the characters. And it should be relevant to the topic and the audience as well. It should be very short and straightforward. It should not be, very long story. And it should have a goal. The narrator should have an adequate body language and facial expressions. And there should be more use of adjectives and verbs. When we come to don'ts, please do not memorize. Because if you forget, then definitely it will be a flop show. Don't make stuff up, of course. Don't forget your audience. Don't forget the human element. Don't make it more complicated for the audience. Don't tell someone else's story without their permission. And never get personal and target a group. Avoid slangs. Please do not overreact and don't say the same story every time. So I would like to mention some of the takeaways from this session is you use stories to create emotional connection with the audience, and it establishes common ground with the audience so that your story can stick and resonate. You don't need to fear public speaking. You just need to know how to tell a good story. And definitely context is the key, and please do not be boring. So lastly, I would just like to end my session by saying this: we are all made of stories, and stories we make us. Thank you so much. So can I have some comments from the audience about my session?
Can you stop sharing the screen so that we can see you?
Yes.
Thank you, Aparna. I think storytelling is a very powerful.
For this opportunity.
Thank you. Thank you. Storytelling is a very powerful pedagogy. I think if one is able to really get a knack of narrating a story, I think everything you can communicate through story. You can motivate people, you can inspire people, you can encourage them, give them vision. A lot can be done through stories. Absolutely. Very well done. Good job. If anybody wants to comment, compliment, or ask a question.
Thank you, Aparna. And you have made my job even more tough.
I think so.
Thank you. So, if Dr. Abhishek, I think you want to say something, please.
I think both of Raminder ma'am and Aparna have done it so well. Like,
thank you, Doctor.
Just so impressed, so wonderfully done. I don't know how I'm going to follow, but yeah, very well done.
Thank you. Thank you, Dr. Abhijit.
Thank you. Thank you. Just one thing I like to say, storytelling we are often using in our classroom also. Many times when we start with the topic, we start with a story and then tell them story with the real life experience with a particular patient. Many times we are using there also. Thank you.
Yes, yes. Agreed, ma'am.
So I think the whole idea of each one of you presenting one pedagogy is that we will learn in depth about these pedagogies. Like, for example, even how do you prepare a present PPT? Although all of us do prepare PPT, but then there are some good guidelines about the font size and number of words and then the color contrast and then all those things. I don't know if somebody has picked up that topic or not. I want somebody to talk about PPT because that's very important topic. Somebody should talk about it. One of you should take that topic as a presentation. Thank you, Aparna, and thank you, Raminder. So moving to Dr. Purni.
Ma'am, I'm next.
Yes, please. Go ahead.
Just a minute, ma'am.
Some challenge at your end?
I've also run into a technical glitch.
Oh.
Just a moment. I think the waiting caused that. Will I be just given a moment to get it sorted out?
Okay. What is it exactly? Your device is on mute mode.
I went mute because I was going to get help. But the thing is that where I have saved it, let me just start it. Is my screen visible to all?
You have to first share screen.
I've shared the screen. Is it visible?
No.
Give me a moment.
Sure.
I'm sorry for the glitch.
No problem.
I think I'll have to just mute.
Sure. So meanwhile, if I ask others who all are presenting in the next week, that is one question. And second, very important one, okay, Dr. Abhishek is presenting, then Dr. Soam wants to present. And who is the third one?
Myself.
Okay,
I have given
Simil. Thank you. So please write in the group that three of you will be presenting. Write your name too. Second thing is Anandita has some challenge with the next date because her parents' 50th marriage anniversary is on 27th. So she had requested that if we could have the session, postponed to another day. Otherwise, she will have to miss it and watch video. So if it is okay with all of you, can we have it on 29th instead of 27th? But it is Good Friday. Is it Good Friday?
Yes,
Yeah,
it's Good
ma'am.
Friday.
29th is Good Friday.
So anybody has challenge with that?
I'm on call on that day.
Mom, I have a problem during.
I understand.
Yeah.
So how about 28th then? That is Friday. Sorry.
Actually, 28th, 29th, we have
Okay.
program in the church.
30th? 30th?
I'm not able to start.
Can we have it on Tuesday, ma'am?
I think I'm traveling on Tuesday.
Okay.
Yeah.
Ma'am, thank you so much for accommodating. It's okay, ma'am. I'll watch the video. No worries.
Because
How about 30th? How about 30th? That is Saturday.
Ma'am, Saturday also will not be possible for me.
So does Tuesday suit you?
Ma'am, by the time my presentation might not be ready, it's like.
Oh, okay. It shouldn't take very long. It's just few minutes.
I'm very bad with technology, essentially. So
that's a good start, I would say.
Madam,
Just 1 second, Dr. Purnima.
Okay.
Okay, no problem. You start. We will discuss this. I'll put in the group and take others' opinions. Yeah.
Yeah, just in the interests of time, I thought that I should.
Absolutely. Yes, please.
So good evening, everyone. I hope I'm audible.
Yes,
And
you
my
are.
screen, thank you for your patience, and I'm sorry for the technical glitch. A very good evening to all of you. And first of all, let me have an icebreaker, because in order to be a good speaker, first we have to be a good student. So my icebreaker is that I have demonstrated the technical glitch and how I got some help in from younger person. So I thank all of you for your patience. And this is the story also which I am telling before I start my session. So storytelling has also been incorporated. So my topic for today, my co-learners and ma'am, is how to set up and execute a role play. As you can see, this is my screen, and I'll be presenting it in the same.
So can you make it full screen or?
Yes, just a minute now. Is it visible now?
Yes, yeah.
So when we say the role play, it is an improvised dramatic enactment of a problem situation. Like you just saw that I had a problem situation, technological. So we could enact this also to do that. So it's an improvised dramatic enactment of a problem situation in order to find new and creative ways to respond. Role play requires the enactment of real world scenarios to help students learn and develop skills used in real life situations. What is the purpose of role play? The purpose of role play is to communicate a message about the topic and not to focus on the person or persons enacting the role. So there are some few steps in how to set up a role play. The first of which is selecting the topic or situation. Here, the situation may be selected, developed, and assigned by the trainer, or may be chosen by the participants. The situation may be one in which the participants anticipate or apprehend may occur, or one which has occurred and they want to improve their past response in that situation. Second step is explaining the situation. If the situation was selected by the participant, then that particular individual is first given a chance to describe the settings of the role play and how many and which individuals are to be involved. The third step is to cast roles. Here, we have to ask for volunteers. If none come forward, roles may be assigned by the trainer. The role players should take fictitious names, and they should be addressed by these fictitious names throughout, even during discussion. They should be given time to prepare and coordinate, which is thus the next fourth step, that is preparation of role players. It is equally important to prepare the observers, and they should be explained that there should be no distractions, and feedback and questions should be reserved during the debriefing session. So this should be made clear at the outset to avoid interruptions. The scene should be set. This includes the physical layout. They can spend some time imagining how the scene would be, what the physical setup would be, and thus the scene should be set, giving adequate time for it. A clear and pre-decided signal to start and stop the role play should be decided by the trainer and explained to all, which is when we run the role play. The role play is to be cut when the issue has been covered or when the cast wants to stop for any reason, the action seems to dwindle. Here I must mention that even when any of the participants or observers appear to be very emotional or have developed emotional reaction, or it seems to be an inflammatory situation, then the role play should be cut with the pre-decided signal. The last step is that of debriefing, which is essential for learning. The tone of debriefing should be exploratory and non-judgmental, and both participants as well as observers should be given enough time to have their observations to be voiced. Now, the way to go ahead is to plan meticulously and set ground rules. Be specific about the description of role play to the participants. Ensure that they are comfortable and they are given room for creative responses and expression. When you are debriefing, you please refer to the characters and the fictitious names and not the individual participants. Start your feedback with positives, followed by points with scope for improvement. Now, the don'ts for this are: do not make too many learning points in a single role play. Do not make it a fault-finding mission. And we should, as far as possible, not interfere when the role play is in progress. There should be no room for lapse in respect. What are the uses? Role play helps a team to prepare for an anticipated situation, or sometimes evaluating the responses which have occurred when it has occurred in the past and to improve upon these. It enhances skills such as negotiation, debate, vastly improves teamwork, cooperation, and persuasion. It does provide opportunities for critical observation of peers and increases confidence and competence through applying different theories and tactics. It is a very effective pedagogy to motivate and engage students. But the requisites are, it requires expert guidance and leadership skills, is a time-consuming process with an element of chaos and unpredictability which can go haywire at any moment during the role play. It has a potential of failure in projecting the message when the group does not understand. Charismatic students within the group may overwhelm less assertive ones. This is a very likely situation which can develop, and it strongly depends upon the student's imagination and the group dynamics. Before I would like to end, I would say that there is a handout which I have prepared on how to set up and execute a role play. And with ma'am's permission, I will share it on the WhatsApp group so that it can be referred to. It is more comprehensive in description than the PowerPoint. Thank you all for giving me this opportunity to present.
Thank you, Dr. Could you please stop sharing?
Just a moment.
Sure. Thank you. I think very well prepared and presented. And I think very comprehensive steps, do's and don'ts, advantages and disadvantages, very well explained.
And I'm really sorry for the technical glitch and interruption.
That's perfectly all right. We all understand, and it's a learning experience for all of us. Definitely, yeah. So any questions for Dr. Purnima?
Just ma'am, but one thing, it's a very well presented, very comprehensive. One thing that, we often say in role play is when the students particularly are doing, young students, that when you do a role play, we tell them to say that I'm not a particular character that they have played. Sometimes, if it is, they have practiced a lot and becomes little difficult to come out of that character.
So that is character identification, which is a potential glitch. And so they have to stay in character, for which we say that they should be addressed by their fictitious names, but at the same time, they should not take it too far and retain their original identity.
Yeah.
Point well taken, ma'am. Thank you.
Thank you.
Thank you.
Very good point. I think role play all of us are using as a way to teach. Only thing is, if we do it in a very structured and systematic manner, then there's actual learning, and also we don't miss any points, and it's more impactful. I think most of the points Dr. Purnima has covered very well. So I request all three of you to please share your presentation in the WhatsApp group for everybody to have a copy of it.
Will do.
Also, if you have prepared a document with it, because I had requested to prepare a one-page Word document of explaining about everything, because I know everything cannot be put in those 8 to 10 slides, so that everybody can have a copy of both the document.
Yeah, we'll share, ma'am.
So, thank you so much. Thank you. So I'll not hold you further. I think it's already 10:10. We'll close it here. I'll share the feedback form in the group with the request to give your feedback. And I will also share a poll in the group. You can decide if the other date is suitable to all of you. Otherwise, we'll stick to the plan, whatever is the plan. But I'll share the poll with you all. Thank you so much. Good night.
Thank you, ma'am. Thank you. Good night.
Thank you. Good night.
Good night, ma'am.
Thank you. Thank you.
Thank you so much. Good night.